Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. Today, we will be talking about peritoneal dialysis, and we have a special guest, Dene Beck. She will be giving us some insight on peritoneal dialysis. And she's a little camera shy, so we won't be seeing her face today, but I'll go ahead and do a bio on her. Dene Beck is a nurse practitioner from Kansas City, Missouri. She graduated with honors from Spring Arbor University in 2019. She received a bachelor's degree in nursing in 2010 from Mid-American Nazarene University. She has several years experience working in telemetry, med-surg, step-down ICU, hemodialysis, and peritoneal dialysis. She started her career in dialysis in 2013, working as an outpatient dialysis nurse at DCI. In 2015, she worked for the University of Kansas Medical Center as an inpatient hemo and peritoneal dialysis nurse. In 2016, she began working full-time as a home dialysis instructor, where she taught and educated potential and current patients about how to perform their treatments in the home setting. So let's welcome Dene Beck to Lady Nephrology. How are you doing today, Dene?
I'm good. How are you?
I'm doing great. I'm just so happy that you took the time out to give us some insight on peritoneal dialysis.
No problem. Thank you for having me on here.
Thank you. So we're going to go ahead and get started. So Dene, what is peritoneal dialysis?
Peritoneal dialysis is a type of dialysis where a surgically implanted silicone tube is placed in the peritoneum space of the abdomen, where solution is instilled into the abdomen space of the peritoneum to perform the dialysis.
And what are different types of peritoneal dialysis?
You have continuous ambulatory peritoneal dialysis, where the patient will manually instill the dialysis from like an IV pole, and then they manually drain it into them, and then they drain it out after a certain period of time. And then you have the continuous cycling peritoneal dialysis, where you use a cycler, a PD cycler, that you would put the solution on, and the cycler will instill it itself into the peritoneum space, and it sits for a certain amount of time, and then does a drain for the patient. So the patient doesn't have to do all the work like you would do in the continuous ambulatory dialysis.
Okay, great. So how is the peritoneum used as a dialyzer?
It's used as a dialyzer as a filter. So the peritoneum space is like a filter. So it's a semi-permeable membrane, where once the solution goes into the peritoneum space, it sits for a while, and through osmosis, it pulls it out, and you're able to drain it back out the body. But it's pulling the toxins out of the body and leaving in the toxins out of the body, like the urine, and then it drains it out through the peritoneum space.
So how does peritoneal dialysis differ from hemodialysis?
Hemodialysis is done in the clinic, set amount of days for a set amount of hours per day for the patient. In PD, or peritoneal dialysis, it is done at home, and you just do it at home. It's no needles involved like for hemodialysis, and blood and all that other stuff. It's just your cycler, your tubing, and you. Whereas in hemodialysis, it's a team of staff members in the outpatient setting that's using needles to go in your arms. Then you have to deal with the blood and all that other stuff, and it's just more of a more work that's taken to do hemodialysis than peritoneal dialysis.
Usually, how many times do they go for hemodialysis?
The average is 3 days a week, every other day.
And what about peritoneal dialysis?
Peritoneal dialysis is done 7 days a week until they have a test called KT/V, or I'm sorry, called it's called what is it called? Oh my God, I'm drawing a blank right now because I'm on the spot. But it's a test that's done after a certain amount of time, where the patient, you check and see how well the dialysis is working. If the dialysis is working pretty well and they have a high, it's a PD version of a KT/V, where the KT/V is a certain number, they can do have a day off, or they can do 2 days off. But it's normally done about 8 hours per night, or however often. And then if they want to continue on dialysis, it may be a 12-hour a night or 12-hour day time on the dialysis PD machine to do the dialysis to get better clearance, if that makes sense.
What are some advantages of peritoneal dialysis?
The advantages is that you don't have to deal with the needles and the blood, and you don't have to leave your home. And you have more of a liberal diet, whereas with the hemodialysis, the diet is not as liberal. And you have a better quality of life because the hemodialysis really take the body down because you're doing a lot of work in a small amount of time, where PD is more of a gentler dialysis and it's slower. So you don't have to worry about that treatment taking a toll on your body. So it's more of a gentler dialysis to receive. It's done over a longer period of time. And you can travel with it. You don't have to set up like if you do hemodialysis, you have to set up and go to a clinic. But if you do peritoneal, you can travel with your stuff, or have the like Baxter is the company, or Fresenius, they can deliver your solution down there or to wherever you're going, and then just bring your cycler.
So what are some disadvantages of peritoneal dialysis?
Disadvantages is, I guess, would be longer on the machine. If you don't want to be long on the machine, the tubing, because sometimes you get kinked and stuff when you're trying to sleep, the alarm and all that stuff. But other than that, I don't see that for just training patients and stuff. Those are only disadvantages I really heard of.
Are there any contraindications for peritoneal dialysis?
Hernias, morbidly obesity is one, because you have to, if you can't really fill them up because they're morbidly obese. A damaged peritoneum space. Those are the top ones: damaged peritoneum space, hernias. If you had any type of surgeries, that's a contraindication. Other than that, no.
How long is the training for PD? If there's a patient that's interested in PD, how long would that training be?
Average patient is about 3 weeks to get it done. Some of them might learn faster, but about average is 3 weeks.
What are they taught during that 3-week training?
During the 3-week training, they're definitely taught how to set their machine up and how to, if they need to troubleshoot getting the solution out of them. Just the troubleshooting part, the medication part, balancing the medication, what they can and can't do on a diet, ordering their supplies, things like that, infection control, wound care, things like that are what they are taught in dialysis. And also if they needed to do any traveling, how to set that up.
And does the PD nurse ever go to their home, or do the PD patient just come there to the clinic?
Initially, they do it at the home for 3 weeks, and then after 3 weeks, they come into the clinic, depending on what the doctor's orders are, once a month or twice a month. And they come into the clinic for monthly labs or every 2-week labs to make sure that the dialysis is doing its job. If the dialysis nurse has to go back out there, it's normally just for an annual follow-up to make sure there's no safety issues out there. Or if they suspect anything, then they'll go out there more often. But normally, once they're all trained up, it's once a year.
And who is a good candidate for PD?
Anybody's a good candidate for PD, so long as they have the mental capacity and drive to learn how to do the PD.
And is there anything else you would like to add about peritoneal dialysis?
I do recommend peritoneal dialysis to every patient if they're able, because again, it's gentler on the body. It doesn't take the patient down as much as a hemodialysis does. If I had to choose it for myself or a loved one, it would definitely be peritoneal dialysis over hemodialysis.
Well, Dene, thank you so much for that information. I really appreciate your time and coming on my channel and giving us some insight. And if people out there, if you know anybody that's suffering with end-stage renal disease, let them know that there are other options besides hemodialysis. So please subscribe to my channel and leave any comments below. And thank you again, Dene. I really appreciate it.
No problem. Thanks for having me on here.
All right. Thank you.
Bye.
Bye-bye.